Healthcare workers enters its day 8th. Healthcare workers have held peaceful demonstrations in various parts of the country. In Nairobi, the Kenya Union of Clinical Officers marched to Afya House to confront the Ministry of Health officials. Musa Salah has the details. As the clinical officers and nurses nationwide strike enters its second week, the healthcare providers have today held separate peaceful demonstrations in various parts of the country. Here in Nairobi, members of the Kenya Union of Clinical Officers (KUSO) marched to Afya House to confront the Health Ministry officials, with its members expressing their concerns on the government's reluctance to solve the healthcare nightmare in the country.
As we talk today, Vihiga County and Kirinyaga have not paid their health workers for 15 good months. And so I want to ask, what should we understand? Should we understand that we are supposed to die? That we are the martyrs of patriotism? Then I think it's time to call on the leaders to be able to provide solutions.
It is only when we feel we are protected is when we shall go back to work. We are tired of continuous promises, continuous orders coming from all sides of the government that they have ordered KEMSA to release the PPEs.
For close to 8 months now, healthcare workers have been complaining of poor working conditions in hospitals and inadequate personal protective equipment.
But what we are saying is that we are not willing to continue sacrificing. We want the government to protect us. We want the government to release the PPEs that are in KEMSA. We want the government to give us a commensurating health risk allowance to the risk that we are involved. If they can't do this, I think we are not willing to go and die. When we know that we die, we will leave a lot of or rather huge bill for our people to continue suffering.
They have also raised their dissatisfaction with delayed salaries. In Nakuru County, healthcare workers have sworn not to report to work until their demands are met, further urging the Nakuru County government to pay healthcare workers employed under the Universal Healthcare Program.
We have done our tools up to the time the government will sort our issues, our grievances.
We are also requesting our governor to pay all healthcare workers who are employed on UHC their salaries. Their what? Salaries.
In Bungoma, health workers marched to Governor Wycliffe Wangamati's office, warning that hospitals will remain deserted if their dues are not paid.
Mgomo utaendelea. Yetu ni kuona ya kwamba yote ambayo tulikuwa tumeomba serikali kuu na ya kaunti itimize, tutaendelea kukua kwa mgomo ikiwa kama hawatafanya namna gani, kama hawatatimiza.
Bungoma County imeajiri wafanyikazi wa afya kwa malipo duni kabisa. Unapata mfanyikazi anaajiriwa kwa contract, kwa mkataba, analipwa shilingi 10,000 ambayo ni kinyume ya sheria ya wafanyikazi.
However, Governor Wangamati said that the plight of healthcare workers can only be salvaged by the national government.
There are challenges, but I can tell you as the chair of finance, I'm at the heart of that discussion. So whatever happens that you are going to give me, I'll raise it. But just know that at the end of the day, it's the national government that has to come up with a solution.
The Kenya Union of Medical Practitioners and Dentists Union (KMPDU) has filed a case against the Ministry of Health and the Council of Governors. The Labour Court has ordered the Medics to suspend its notice of industrial action, further giving the accused 7 days to respond to KMPDU. With the case expected to be heard on the 15th of December, the court has not barred KMPDU from holding negotiation talks with the government. Nurses and clinical officers abandoned duty about a week ago, and the government's reluctance to respond to their demands is not only killing healthcare workers, but also Kenyans who are in need of healthcare services. Musa Salah, TV 47, Nairobi.